Hi, I'm Matt Ford with DETV News. Tonight, we bring you a special in-depth conversation about a public health issue that continues to impact thousands of Delawareans, and that's HIV. Federal funding cuts and policy changes are threatening the future of prevention and treatment programs, as you may have heard, especially in smaller states like ours, where community organizations often fill those gaps. Joining me today is Tyler Berl, Executive Director of the Delaware HIV Consortium, the state's longest running organization fighting the epidemic. We'll talk about what's at stake, who's being affected, and how the state might need to step in as federal dollars dry up. Tyler, for those watching around the state, can you tell us a little bit about the Delaware HIV Consortium and your mission?
Sure, Matt. Thank you so much for having me. So the Delaware HIV Consortium is one of the oldest and largest AIDS service organizations here in Delaware. It's ultimately our vision to work to end Delaware's HIV epidemic. We do that by partnering with community-based organizations in the state, as well as providing our own services, from HIV prevention services like testing and PrEP navigation, through condom distribution, through care services as well, housing and emergency financial assistance and case management. We've been doing this now consistently for about 35 years or so.
So, Tyler, I want to ask you, so you told us about your organization and the mission. Can you give us a snapshot of how the federal funding has shaped HIV prevention and care up in Delaware up to this point?
Sure. So historically, HIV services in Delaware, both on the prevention side and on the care side, have largely entirely been funded through federal funding coming from Washington. Now, this is not unnormal. Largely, the public health response for HIV has always been funded primarily by the federal government. Now, but with the majority of funds coming almost entirely from the federal government, that does place us pretty close to the bottom in the nation, with states in the South for the percentage of funds that come from the federal government here. And like I said, virtually the entire set of services to our community are funded through the federal government. And so when you have issues like ours where federal funds are threatened, then it exacerbates the situation when you don't have state support to back up the services that we provide as well. And so quickly, when you have challenges, it can be exponentially increased when there's no backstop to support our community.
So on that then, Tyler, you've been quoted in other publications and articles recently as saying that HIV touches every zip code in the state of Delaware. So what does that say about the nature of the epidemic today in 2025 versus decades ago?
Sure. So in Delaware today, there's roughly 4,000 people living with HIV up and down our state. If you think about it in terms of our population, that's roughly 1 in every 250 people here in Delaware living with HIV. HIV is found in every zip code, like you said, in the West, in the East, in the North, and in the South. And so we all have friends and family, if you know it or not, who probably living with HIV. It probably impacts your life. What I will say, though, is that HIV, like many of our syndemics or challenges in our community, does not impact everybody equally. This is an epidemic that has always been targeted at the marginalized communities. And so Delaware still today has the majority of its HIV epidemic focused in the African American community, here in Wilmington, the LGBTQ community, and those who have low educational attainment or financial security. And so anything that we do will necessarily impact these marginalized communities to a greater extent than the rest of the general population. And so we as an organization always remain concerned about how any challenges that we see here will impact those in the greatest need here in Delaware.
So Tyler, as a subset of that question, when you're looking at all 50 states, are you able to tell us where about Delaware ranks in the 50? And does that make sense to you with the population of the states and how large the states are? Can you speak to that a little bit?
Sure. What we know is Delaware is in the top 1/3 of states for HIV incidence. We also know that Delaware is number 3rd in the nation in HIV-related deaths recently. And so what we know is that whereas though we are not the largest state by any imagination, we aren't the largest number of people living with HIV in Delaware. What we also know is that we don't have the most comprehensive set of services for our community. And so it also does truly make sense why we would have higher incidence, higher rates, and probably higher deaths for HIV. It's because we don't, because any challenges that we have, any cuts to funding, are felt across the entire state.
Interesting. Because when you're looking at the map, I'm sure viewers think, wow, we're around New York and Philly and Baltimore and DC. You would think that we probably get that big influx of funding that those states and cities do.
Sure. If you look at it in terms of raw numbers, you have Washington DC, you have New York, you have Philadelphia, who all have a larger population of people living with HIV, undoubtedly. But they also have a much more comprehensive set of services and a comprehensive set of aid service organizations and healthcare providers to meet this need. Whereas we've seen here in Delaware for years now a hollowing out of our public health system and our HIV healthcare system through funding decisions and apathy and whatnot. And so we just know that if we continue down this path, we won't have a public health system ready to support the community if and when we have a true HIV epidemic as a result of not having access to services.
Now, the Delaware HIV Consortium has lost about 80% of its public contracts for prevention. How has that changed what you're able to do, what your organization that you lead is able to do on a day-to-day basis now?
Sure. What this means is we don't have the staff that we used to be out in the community. We know, and the community knows, that if you are going to find people who are previously undiagnosed with HIV, you're going to do so by going out into communities where people are residing. Most people don't want to go into a state service center. They want to go into the communities and the organizations that they trust because the providers look like them, sound like them, or are prepared to speak in their language. So what we know is that when we receive cuts to funding like we have over the last couple of years, then we just don't have enough staff or capacity to go out and spend the time deep in the communities as we need to find people living with HIV. And it becomes an issue because if someone, the number one way to end the HIV epidemic is to prevent people from becoming positive to begin with. And so if you're not testing people in the community, then people can be living with HIV longer and potentially spreading the disease further across to other people living with HIV. You want to test as many people as possible. And we as an organization, or we as a sector, just aren't able to meet the need in every zip code, in every hour, to provide those preventative services to the community.
You talked about the spread of HIV, and for those who are watching, some may be like, I'm too embarrassed to ask of how it is spread and what is the misinformation and disinformation there. Can you give us the basics of what HIV is, what AIDS is, and then how the virus or the disease is spread?
Sure. HIV, human immunodeficiency virus. It is a virus that passes through blood, through semen, through sexual contact, through injection drug use, and it's the spreading of fluids from one individual to the other. It is a disease that impacts your immune system, and so if you become truly sick with HIV, then your immune system can't fight off other viruses, and you become sicker. AIDS is the advanced form of HIV, and that's truly when your immune system can't stop infection from other pathogens. Now, but what I will say is, now where we are with HIV, we have fantastic treatments. We have fantastic prevention services that are available. So someone who stays adherent to their HIV medical care can live truly long, full lives and healthy. It is truly a disease that can be just like any other chronic condition, where if treated, you can live a healthy life. Now, and also at the same time, if you truly manage your HIV, you can't pass the virus on to other individuals. And so, but the important thing about that is for people to know that their HIV status, as well as get treated, so you can't pass the virus on to the other and you stay healthy. We have fantastic prevention tools like antiretrovirals, taking a prescription every day called pre-exposure prophylaxis, PrEP, that while it's not a vaccine, if you take it regularly, it prevents you generally, almost virtually 100%, from acquiring the HIV virus and staying healthy. It's the best tool we have now. People just generally aren't aware of it, so we aren't in Delaware seeing vast uptick, and it's a concern of ours. But we have the tools, we just don't have the attention now to treat and end our HIV epidemic in Delaware.
Right. So what I'm hearing with PrEP, you see a lot of billboards and commercials now and social media advertisements on Instagram for PrEP. And I just want to make sure that our audience understands that is a newer, I would say in the past couple of years, right? Newer medication that if you have a partner, a husband and wife, and have sexual contact with someone, and you are taking PrEP regularly with, doctors' orders and things, you can prevent yourself from spreading the disease if you have it, or catching it by having sexual relations or drug use or whatever it may be, needles, from someone else. Correct?
Sure. Yeah, that's exactly correct. You can either take it in pill form, or you can take it as a long-term injection. And if you take it appropriately, it will prevent you from acquiring HIV. The issue is, like you said, it's a newer regimen. But it's also our best regimen, probably better than condoms and the other risk reduction modalities. It's just people aren't aware of it. As a new intervention, people aren't aware of it, and they need to understand it. It's just not regularly in our advertising. It's not there. People aren't understanding, and a lot of times the advertisements that are available for PrEP don't show specific communities like African American women, and so or heterosexual couples, and so people feel as though even though it's the best modality we have, they think it's not for me because it's not showing them. And so what we're seeing is our prevention community here in Delaware isn't broadcasting this enough because they don't have the resources to show and tell people in the community how important this is and how it is for you. And there isn't enough resources to get that word out there, to walk people through this prevention tool and overcome some of the barriers and challenges to get on it. Even though it's the best tool we have, there's just not enough resources to promote it.
Right, no, that's good information to get out there, thank you. I want to go back now to the operating loss. So services are operating at a loss, as we discussed. How close are we to seeing some of these programs honestly disappear entirely, Tyler?
Sure. What I will say is that, I started off by saying that Delaware's HIV prevention program, both on the public side, our government, public health individuals, and our community-based organizations who are providing these services, are virtually entirely paid for by the federal government. I will say that for years now, in both in both Democratic and Republican administrations, we've seen an eroding of the public support financial dollars to our prevention community. So this is not a political issue. This happens across the board here. But what we've seen is at the peak, our prevention continuum was paid for by roughly about 2.5. At the same time, we are dealing with a federal budget for next year, 2026, being proposed right now that could virtually eliminate all CDC funding for HIV prevention. And even prior to that, the administration has cut roughly 10,000 people from the U.S. Health and Social Services Department, and a lot of that comes from the science, the research, and the individuals who are paying for services at the state level here as well. So what do we see? We have concerns that if all of these things do materialize, that virtually 100% of Delaware's HIV prevention funding will be taken away. This is a slow-moving crisis. Now, this isn't going to happen today, but if all these things happen, we could virtually lose both our government public health infrastructure, all of the people who do surveillance, epidemiology, our disease intervention specialists. So if someone tests positive for any STD across the state, they go and work with their networks to stop the spread of that HIV or other STD spread. We have lost. We know that also if that goes away, our condom distribution programs here in the state of Delaware, our research to understand where our HIV is spreading, our surveillance team would all go away, and all of the community-based organizations, the funding for these community-based organizations will go away. And so your PrEP navigators, your HIV testers, your testing kits, and the like. Will that have a large impact? Truly. Now, just like everything else, HIV is a stigmatizing disease, and so you don't hear about the challenges immediately. It's a very silent disease, and we won't have an immediate impact. People won't come into the emergency rooms tomorrow, but we can see the writing on the wall. This is a public health crisis that is going to be slow-moving, but will have a true impact. Every time someone is diagnosed with HIV, they have a lifetime healthcare cost of roughly $500,000 per individual. And that's largely if we have a vast outbreak of HIV because of cuts, then we know that that will be largely felt by our state healthcare providers. It will have an impact on the federal government funding. It'll have an impact on our state budgets. It'll have an impact on our community-based organizations who are providing this work, and the community who are going to feel these cuts. It's going to have it's going to be felt across our state.
Gotcha. So these national cuts, federal cuts, are definitely going to be felt by those here who are living with HIV or possibly may in the future.
Both those are at risk and those are in the system already. What we know is that already, even before anything going on in the federal government right now come to impasse, that the Delaware Division of Public Health has already had to cut roughly 2/3 of their disease intervention specialists as a result of having COVID money clawed back. They've already had to cut their medical monitoring project, a survey tool. They've had to cut their loss to care individuals. So if someone is living with HIV but falls out of their health care, they get them back into their health care so they stay healthy. They've had to cut their mail order condom distribution program. And that's all of these cuts have already happened that are being felt already. That's not even talking about the cuts that organizations like mine have already had to make. One of the largest LGBTQ providers in Rehoboth have already had to cut virtually their entire HIV prevention program. You have organizations that target African American community here in Wilmington who have lost all of their funding for prevention services. Organizations like mine have had to cut virtually their entire prevention program staff and are doing it at a loss already. So we know that for years now we've felt a hollowing out of our public health system in HIV. And so if the remaining money is taken away, it will have a true impact on our community.
I want to switch here a little bit to a statistic that you had shared with us, and I want to let the viewers know. Since the year 2020, Delaware has seen a 25% rise in new HIV cases. What do you think is driving that increase?
Sure. What I will say is I don't have a truly intellectually satisfying answer for that. What I do know is that, like I had said, HIV, people being diagnosed with HIV is a lagging indicator. That in a lot of instances, when someone is diagnosed with HIV, they are sick potentially, or they've had the HIV for a while. And so what this could be is that we know that a lot of HIV prevention services saw a reduction during COVID, but we also know that people didn't stop behaviors during COVID. And so they could have been, they could have acquired HIV during the COVID epidemic, and they just are being caught now. This could also just be, like I've said, even till now, we've seen years of reduction in funding for community-based services. So we've seen over the last couple of years a 50 to 70% cut in the funds available for services in the community. And so people being diagnosed now could be as a result of not being able to access services in the community for the last couple of years. We know that people like to that we like to receive services in the communities that they trust, and a lot of people at risk for HIV don't have a primary care provider, aren't being tested at at the doctor's office, and so they're being tested, either when they're sick or in an organization like ours, a community-based organization, who goes and asks them to be tested. So if organizations like mine aren't able to be there to be tested, then you're potentially further spreading the disease. And so we are, like I said, like you said, we've seen a 25% rise, and this is a year-over-year rise. This is not a blip. We are concerned that where we have had years and years of success of very positive improvements in HIV here in Delaware, where we were close to ending our state's HIV epidemic, we are truly concerned about this rise of 25% over the last couple of years. We think that we are just seeing the start of this.
That is a big concern. You led me into my next question. What other concerns do you have, Tyler, as a leader in the state of Delaware that knows way more than the average person about this, about HIV, the current trajectory of the past 5 years? What else concerns you about the trajectory?
Sure. We know that people who are at risk for HIV are also at risk for other STDs, and so we are seeing rises across the board in STDs here in Delaware. We are also at the same time experiencing. We know that this is not an isolated incident. That we are at the same time across the state, across the nation, we are seeing threats to our reproductive health system post-Dobbs. We know at the same time we're experiencing rising discrimination in our LGBTQ communities. So HIV is a true issue, but it is also just one issue that our stakeholders are dealing with that all need right attention. This is not isolated, but to address these things in a true fashion, our community needs trauma-informed providers that are trusted in the community to provide services to them. And so we need a strong public health system to stop all of these related epidemics. And so you want to make sure that our organizations are strong and available when the need is there. We don't want another COVID situation where we aren't prepared to meet the needs. And we've been fighting as the HIV sector for 30 plus years, 40 years now, to build up these systems so that we would be available to the community who needs it. And we're concerned that is at the precipice or in threat at this point.
Now, so Tyler, listen, our PCPs handle a lot each and every day, right? They're generalists, so to speak. When you have a patient that walks in, or say, the PCP, gives their patient an STD test and an HIV test, and it comes back positive, and say the PCP doesn't know a ton about HIV, and they are generalists, are there programs? We know there's educational programs for individuals who aren't doctors, but are there also programs within the state or nationally that doctors can learn about and PCPs can learn about, about HIV and how best to treat a patient?
Sure. So one of our best resources is a federally funded program called the AIDS Education Training Center. It is paid for through the Ryan White HIV/AIDS program at the federal level. We have some of the best HIV educators here in the state of Delaware through the AIDS Education Training Center. Our concern that they go out to doctors' offices, they go out to HIV counselors and LGBTQ organizations to provide the latest in science in a manageable, understandable, layman's way to make primary care providers as well as individuals feel safe and supported as they speak about HIV. Now, while we have some of the best educators out there, we also know at the same time that our federal administration's current budget that they're proposing now, this FY26 budget, also fully defunds the Ryan White program, Part F that funds our AETC. So we are concerned that if this passes, our best recourse for training our next generation of providers won't be available. Now, at the same time, we also know that HIV education is best suited from an early age and done in an appropriate fashion to learn, a part of your sexual wellness programs at the school-based level. So we have organizations like AIDS Delaware who do education in the communities directly in school-based organizations who are also could be impacted with the loss of funding if further cuts erode the system. And so we are concerned that you won't have primary care providers who are educated about HIV. At the same time, you're concerned that our children aren't learning about HIV and HIV prevention and risk reduction and other sexual wellness programs in the community, in an educational setting as well.
Makes sense. You touched on it a little bit earlier in the half hour, but I want to go back to Dover. You've been vocal that the Delaware state budget has never included HIV prevention. Two parts. Why do you think that is, and what would it take to change that?
Sure. I think that the first thing that we should really just wrap our brain around is that for roughly, like I said, our HIV prevention infrastructure costs roughly $2.5 million or potentially $2.5 million per year. Now, at previous funding levels. Now that wasn't meeting the need prior, but at least that was the system that we had. If you think about $2.5 million in a state budget that is now projecting this year at $7.08 billion, we're talking about roughly 0.034% of the state's budget. So I say that to say, if the state had to assume these costs, we're talking about less than pennies on the dollar, 0.034% of the state budget. For the amount of good and impact that could have, it seems like a strong investment to me. What I will say is why has the state government never funded this prior? I will, like I said, HIV, most states don't largely support HIV through the public health system. And so we're not alone here, but I think that, for years now, we have rested on the laurels of our federal government to pay for this, even though we understand, like in all of COVID, public health is a local matter, and we believe that it should be supported on a local matter. We should have a say in this for instances where the federal government has shocks or eliminations that that the state has a local say in this, so that we aren't dealing with matters where the entire system could fall, which we're concerned about now. Like I said, with a lifetime treatment cost of $500,000 per individual, where the state and our public health system or our public health insurances assume most of those costs, it seems to make logical business sense as well that you'd rather treat it when it's cheaper through the public health prevention system than pay for it on the back end with additional tax dollars. And so it just seems as though whereas the state has rested on the federal funding system prior, so they didn't have to assume the cost here locally, it just doesn't seem like a sustainable system anymore if you're worried about a true rise, a true outbreak of HIV here in Delaware that could have vast impacts on people's lives and the state's budget.
So if that federal funding does disappear, in your expertise, I know you don't have a magic 8-ball here, how quickly would Delaware's HIV prevention system collapse without action?
Sure. What I will say is that we won't feel an immediate impact of rising HIV because we know this is a lagging indicator, like I said. But what I will say is that we will start seeing a degradation of our system almost immediately. I was speaking with the Division of Public Health today, actually, and they told me that their next contract for HIV, federal contract for HIV, is supposed to start on June 1st. So roughly, a few days from now. They haven't had word from the federal government that they've received any, their grant for HIV prevention for this next contract period. So, if that is not provided, then there wouldn't be funds to fund either community-based organizations and pay their contracts as of June 1, and all of the staff that are paid for largely through federal grants at the state level wouldn't have immediate salary support as of June 1. Now, the state government wouldn't, fire those individuals immediately, but, they would be reallocated outside of HIV, and that doesn't help our system in the slightest. And so, the organizations like mine who are providing this care all prioritize and know that you won't stop the HIV epidemic unless you provide HIV prevention services. And so we won't shutter our doors, but we'll continue to lose funds year over year, and that's not sustainable. Organizations like mine have been operating at a loss for some time now, particularly for prevention services. And you can't do that forever before organizations like mine start to close down. We won't be closing down, but organizations like mine will. And so, like I said, HIV diagnosis being a lagging indicator, by the time people start presenting as sick in the emergency rooms, right. You just hope that organizations like mine are still available and around to provide true good services in the community to treat and prevent and care for people living with HIV. Again, the most marginalized members of our society.
Speaking broader, Tyler, how concerned are you that cuts to HIV prevention on the federal level, trickling down to the state level, could have ripple effects with other public health crises? Truly. And I also know that HIV doesn't know boundaries and borders as well. And so, if you're cutting national research funds for HIV, if you're cutting national public health services for HIV, if you're cutting national funds that come into our state or other states for HIV prevention and care, that it's not going to stop at the border. We're going to be feeling this both in HIV, in substance abuse, mental health, in housing, from Delaware-specific residents, but then around as well. And so again, it's our sense that public health is a local matter, and so we should have a say and a stake in our public health communities, either be it mental health, substance use, or STIs, sexual wellness, and other related diseases and epidemics and syndemics like ours. So it's when one aspect of the public health system is weak, the rest of them are at risk as well. This has been a really informative special, and I thank you for sitting down with us. For the audience, our viewers who are watching, up and down the state, I'm sure they're asking the same thing that I want to know. How can everyday Delawareans get involved or even help pressure state, local, federal lawmakers to act on this issue? Sure. If
you believe that this is an issue that impacts us and every member of our community, our elected officials want to hear from you. Both at the federal level, our Congresswoman McBride and Coons and Senator Blunt Rochester, they want to hear from you, but they support us. But it's your local elected officials, your state representatives, your state senators who also need to hear that this is important, that you prioritize this. And so I'd ask you to reach out to them and talk to them directly or through your social medias. They need to hear that public health is a priority here in the state of Delaware. As well as to the state, as well as to the state governor, Matt Meyer, and our other, local officials, our mayor, Carney, and the like. At the same time, HIV is a stigmatizing disease. The most important thing is to know your status. Our community-based organizations are still here. I'd ask you to get tested now. That this is not a death sentence and it's not something to be scared of, but it is important. So get tested and also make this, help break the stigma so we can talk about it and address it at the state level, in our local levels.
So it sounds cliche, but their voices really do matter.
Voices
speak up.
Voices do matter. And I also understand that this is one priority when we're feeling as though there's a lot of priorities out there. But this is something that we can have a true impact on for not a lot of money either. So I'd ask you to raise your voices to show that HIV, the LGBTQ community, the marginalized communities are important, cared for, and supported here in Delaware.
Again, very informative sit down with you. I appreciate you joining us today, Tyler.
Thank you
very much. Our thanks to Tyler Berl for his time, his insights, and of course, his ongoing advocacy. As we've heard, HIV prevention and care aren't just public health issues. They're matters of equity, access, and justice, and they affect people in every part of our state, as Tyler had mentioned. If you'd like to learn more, donate, or get involved, visit DelawareHIV.org or check out the website resources that we have at DETVCH.com. For DETV News, I'm Matt Ford. We'll see you right back here next time. Good night.